Pathology is just an amazing way to touch people's lives, even though they don't really even realize that you're their doctor. But I feel like this is a profession where I make a difference every single day. Hi, I'm Dr. Dahl. I am the Associate Director for M-Labs, the reference laboratory for Michigan Medicine's Department of Pathology. I'm an anatomic and clinical pathologist, and I have special interest and expertise in GI, liver, and placental pathology. Pathology is virtually unknown to most patients, to most people. They've potentially heard of the lab and get a biopsy done or have a surgery done, and then some report comes back and it has the diagnosis. Pathologists are actually an integral part of every patient's medical care. We have 70% of the information that's in your health record is on the basis of your lab tests or the diagnoses that we render. So my biggest goal in pathology is to increase the visibility of pathologists as physicians that are invested in the care of their patients. The most fascinating part of pathology to me is just the discovery. There is no end to new discoveries in pathology. I've been looking at patients' tissues for a couple of decades, and now the way that I get to look at them has changed because we've got new ways to test that tissue. So diagnoses may stay the same, but the way that we can treat patients more effectively with those diagnoses, because we are able to do some genomic tests or metabolic tests that weren't around 20 years ago, that's really exciting. That's not going to end. We're going to keep making new discoveries and making a difference in people's lives, and that keeps me really enthusiastic. What I love about pathology is that I get to see patients every single day, not necessarily face to face, and understand whether their tissue is healthy or whether their tissue has a disease in it. And if their tissue has a disease in it, what are the best ways to treat it? We can look at it from just a diagnostic perspective, if it's an inflammatory condition or if it's cancer. And then we can do a whole bunch of other tests that will help guide the treatment for this patient, so it's not just, okay, let's try this medicine and see if it works. The more that we're learning about these diseases very specifically and able to develop tests about who's going to respond to which medications, pathology is just an amazing way to touch people's lives, even though they don't really even realize that you're their doctor. But I feel like this is a profession where I make a difference every single day.